We're moving to the next. We are trying to discuss what epithelial stroma tumors of the ovaries. So for these epithelial stroma tumors of the ovaries, there are different types. We have the mucinous, we have the serous. We have about 5 types of them. So pick it one by one. Now we just want to look at the serous series. Do you understand? Like, they are all serous tumors of the ovary. Do you understand? But they are classified based on their, how will I put it, advancement. So serous cystadenoma is like benign. Serous borderline tumor is in between benign and becoming malignant. Then the high grade or low grade serous carcinoma, that one is, of course, cancerous. Do you understand? So let's look at it. Now you can pause this video to actually look at how a serous, carcinoma of the ovaries will look like. So let's look at the serous tumors. These ones, they originate from the epithelial cells that resemble those lining the fallopian tubes. They are categorized, and this is based on their behavior, based on their advancement, like I said. So this is the histology of the serous. Don't mind the other ones. There are other types. Like I told you, you have the endometrioid, you have the mucinous, you have the clear type. Okay. So for the serous, for the serous cystadenoma, they are non-cancerous, they are benign, they are friendly, they are fluid filled. Okay. Histology is lined by simple serous epithelium, often resembling what? Fallopian tube cells. Clinical notes: they are the most common benign tumors you have. Okay. So let's move. We have the serous borderline. Alright, serous borderline. This is a serous borderline tumor. This is a histology. But somebody watching this, probably you are not a medical student. You don't really need all this histology, right? Just look at the picture, how it is. Okay. So medical students, they need a histology. I'm making videos for patients, also for medical students. So for nature, they are intermediate. They are benign, but if you leave it, they will become malignant. Histology shows architectural complexity. You can pause to observe the histology. Okay. So behavior, they can spread to peritoneum or lymph nodes, but they lack destructive invasion. Prognosis is favorable, no problem if you diagnose it early and you initiate treatment early. Okay. So moving forward to the carcinoma, we have the low grade one. Of course, high grade one will be much more dangerous than the low grade one. So for the low grade one, is malignant, but it is growing slow. Okay. Its histology is invasive with mild to moderate atypia. So the cells are looking kind of different from the cells that usually be there, but not really much. Okay. So often affects younger women. Okay, of the median age, about 43. Treatment: surgery, surgically resect it, followed with chemotherapy. Then for the high grade, those ones are growing so fast, they are aggressive, highly malignant, they are atypical. The cells are looking completely different from what used to be there. Right? Origin arises from the fimbriae, that's the end of the fallopian tube, not the ovaries itself. So it actually spread to the ovaries. So clinical features are the most common. Unfortunately, the high grade one is the most common. All right. Risk factors: if somebody has BRCA1 or BRCA2 gene mutation, or your age is about 60, or you have never ever given birth in your life. Okay, it's high risk. Treatment is surgery, then also chemotherapy. So this is it for the series of the serous type of ovarian tumors.